All right, Al. Thanks for dropping by. Thanks for being a part of our podcast. And it's really great to put a face with the name. I told you I've heard about you for a while, so you're a legend, is the way I see it.
I guess in somebody's mind, not mine.
Yeah. So tell me a little bit about you and health tech.
Sure.
Or HTEC.
No worries. So, 25 plus year veteran in the healthcare life sciences space. Started off my career as an engineer on the shop floor, mechanical,
All right.
in orthopedics. Moved
So
over.
you
to,
got your hands dirty right away.
I got my hands dirty doing tool design. Doing what engineers typically do when they're mechanical, right on the ground. Made the transition into consulting. Went to work for a company called the Green Dot at the time, Deloitte. That's where I got my consulting chops, as I like to say, where I grew up.
Right.
Moved into different roles in mid-market consulting, up-market consulting, firms like the big firms like IBM.
Oh, wow.
Cohn-Resnick, so Cognizant, and did a little stint in the software space in revenue management and healthcare life sciences.
Okay.
So now I work for a company called HTEC. We're a digital engineering firm that focuses on both hardware, firmware, embedded on the mechanical side.
Yep.
And then on the software bespoke side, we do a lot of software, AI development, cloud migrations and solutions and that, driving more around AI in the back office, as well as trying to help our clients with building AI in some of their devices.
Sure. So when did HTEC, I want to say health tech.
Yeah, hey,
when did HTEC really get started? When did it move into the healthcare revenue cycle
So
side?
it really moved into believe it or not, it's kind of funny. HTEC is one of the only digital engineering firms that built their own device.
I like it.
So, they built their device because of the fact that they wanted to show Apple they could build a device. So it wasn't even in the health industry at the initial focus. So they built what they call HUMIDs. It's a cardiac device that does test fibrillation. So they built it back in 2008. We've actually licensed it out. It's actually going now in China, but it wasn't what we wanted to do. We wanted to be a services company. We wanted to build capability for our clients. The organization started, like I said, in 2008. It's based out of Palo Alto. We have over 3,500 engineers worldwide, mostly in the Eastern European side. Spain, nice place, Grenada. Maybe we'll go sit.
Hey,
I don't know, right? We'll take a little trip.
Yep.
And then also in Central America.
Okay.
So, and we focus within the healthcare life sciences space from SMB up to upmarket.
Sure.
It's a very entrepreneur type organization. Kind of looking to partner and grow with other firms, including like maybe with you guys.
Yeah.
All right.
So that was going to be my next question. So we're an AI company, right? We've been in kind of the back office AI space for about 20 years, really before AI was the big sexy buzzword, right? So if I came to you and say, Al, I'd really like to work with HTEC, what would that look like for our company?
So we would partner. Obviously, we'd want to partner up with you, right? Well, the way we would work is figure out where are the synergies that we can bring to the table that you already have capability.
Sure.
But maybe you're looking industry expertise.
Yeah.
Maybe in other industries, not just the healthcare space. You'd partner with someone like me who's an industry managing partner.
Yeah.
Then you would work with our engineering lead. So we have a chief AI transformation officer, a chief AI officer.
Yep.
So two different things. One's transformation internally and one's for a client facing.
Sure.
So we would build out the models that would associate what does it mean to really partner with you.
Yeah.
So we're the type of organization, because we're a smaller organization and relatively small.
Yeah.
We have a little bit of flexibility how we contract. We can do contracting directly on, value based.
Yeah.
We'll work with you and we'll generate whatever value we're sharing that. We'll do the retainer based model, the staff hog model, and then the project based model.
So if we're continually working on R&D projects, so if we've got one, would that be a place where we could start, where I could come to you and say, Al, one of our R&D projects, say, is predictive analytics, and we want to hone in on that. We're busy doing the rest of our platform stuff. Would that be a starting point?
That'd be a great starting point for us. One of the things we usually say about our engineers is we hire the 5% top engineers in all the Eastern Europe side, so
nice.
European side. So smart engineers want difficult problems.
Right. True.
So that would be a great place to start because so we similarly do that with MedTech.
Yeah.
We actually work with their innovation teams to build MVPs for their surgeons, for their doctors. We bring it. We actually do the entire modeling. We do all the data, the analytics, the actual physical build of the device. And then we work along with some of the AI stuff as well.
Okay. So if you kind of had the perfect thought of AI solution for revenue cycle, what would that look like in your mind?
It's kind of interesting because when you talk about revenue cycle management, right? I've played in that space.
Yeah, you have. And I heard that. I picked up on that.
And it's either been done on spreadsheets. It's been done like Revitas and Model M, which is now a new company. There's other companies out there. There are also companies that try to build it within an SAP or an ERP function.
True.
Right. The way I would say looking at revenue management is that you still have your core functional ERP system that handles your financials, but you really need to address and understand the workflow. Right. So what does it mean to work in a pharmaceutical company where you have chargebacks and rebates? Right. What does it mean when you're looking at it from a payer provider perspective? So we would look and build out the use cases, identify what the workflow looks like, see where the technology fits that you've already developed. Right. And then together come up with different ways of working, right? Even looking at different industries as well to kind of pull in what's in finance, what's in insurance, things like that.
So that's great to hear because that, I can tell you've had revenue cycle background because that hits right where we're at on our thought process. But let me ask you this. So, my thought is I always tell our clients, especially when we're first getting involved, is it doesn't matter what technology you have today. What we're doing is automating the process on the back end. So, what would you say to a client, maybe even one of our clients who said, look, Chris, I've got 5 technologies in flight right now. They're EMR. I've got my clearinghouse. I've got my back, so I think I'm good. What would you say to that?
I would probably say to the client, I said, understand that you're engaged in some very expensive initiatives. But of those initiatives, where's your revenue leakage? What are you not controlling in cost?
I like that.
So at the end of the day, when you think about investments in technology, you want to also understand that if you don't focus on the financial aspect of your business and where you're losing revenue, it's like manufacturing. The cost of quality. Right. So what's the cost of the last revenue? What does that mean for you every year? Right. So if you were to look at something on the RCM side, you'd be looking and say, hey, if we put this initiative here, right? And like for us, we would partner with them and we would work with you guys. And say, if you're able to save 20% of your of revenue leakage, wouldn't it be that great that you'd be able to pay for some of those other programs? Right? Or wouldn't you want your shareholders or your investors to look at it and say that now you have profitability margins have increased because you've been able to control that loss? Right. So depending on, I would say a payer is a more financial institute, right? So it's all about ensuring that you have cash to be able to generate cash. So it's the same thing for most companies out there. You want to make sure you control that revenue leakage.
Well, I like the revenue leakage kind of thought process. And what we're hearing is, my EMR is also going to start automating. We hear that a lot, but what we look at it from is, sure, your EHR probably is going to do some automation, but they're confined within the process of their EHR platform.
EMR, EHR,
we're wide open, right? We're wide open. So anything that your EMR, EHR is doing today that you're still having revenue leakage, that's where we jump in. So, what are your thoughts around everybody is wanting to say they're doing AI or they're doing automation? What are your thoughts around that?
So it's kind of funny. I was attending an AI governance conversation from another person, and they were, politely saying everybody's got AI in their model. Right? We got AI. You got AI. It's almost like an Oprah show. You got AI. He's got AI. Everybody's got AI. Everybody's walking out with AI. Right. So what I would actually say to a client is, first of all, validate what they mean by AI. When I deal with clients directly, the first thing I try to understand is, what is the business outcome? What are the KPIs that you're looking to measure for that business outcome? And what's the technology landscape look like from your data perspective?
Yep.
Right. So when I look at all those things, sometimes you find out that they're not really doing AI. They're doing predictability. Right.
True.
They're just
True.
doing manual reporting.
Yep.
They're automating
Yep.
some key processes
Right.
that help them become more efficient. They're not really taking it to the next level of what AI should be doing, which is
Sure.
providing insights, providing recommendations, and learning.
Yep.
Right.
Yep.
Keyword is learning.
Yeah, learning. Yep.
Right. So what I would tell clients in that space is like, look, evaluate your vendor based on the thought leadership they're bringing to the conversation.
Sure.
Evaluate with the thinking of the what's the possibility of the impossible.
Yep.
I attended a session where the founder Shazam was a guest speaker, and he brought up some points, and the one that really resonated with me is challenge the status quo. Don't just say something can't happen because it can't happen.
Right,
So think outside the
right.
box, and that's how you innovate.
Yep.
Which that's how I would kind of talk to a customer
Yeah.
as well.
You know, that's a great point because when we first went out to market, you know, AI was so new and nobody really understood it, and they didn't believe that it could be automated. Prior auth is one of them. You know, look, we heard this time and time again. Look, we probably understand that you do a lot of this, but prior auth is its own animal. You can't do it. And that's what we were kind of confronted with. And we had to go out and say, hey, let us show you. I mean, that was the only way we could get through that barrier is let us show you.
Well, 100%. Most of the times you have to make that investment
You
to
do.
demonstrate when you're bringing a new capability to a customer and they're used to. So when I was as an engineer on the shop floor, I used to do a lot of lean training, and a lot of it had to do with demonstrating what could be done
Yep.
by simplifying it.
Yeah.
Simplifying it means you break it down to its core process, which means that you take everything that's done and you look at a value stream and say, here's how the information flows. This is how the financials come
Yep.
in. This is how everything is. And you lay out the process. And once you can demonstrate that you can replicate the process and demonstrate that the outcomes are the same,
Yep.
if not better than what you were seeing from non-automation,
Sure.
then people tend to believe, but
Yep.
there's always
Yep.
going to be the human factor, right?
Sure.
Like, we
Sure.
talk a lot of people talk about human in the loop. I talk a lot about AI in the loop.
Yeah.
You still need the human factor. AI comes
Yep.
on top of it,
Yep.
right? So
Yep.
it's efficient. So, I can understand the challenges, but I think with customers today, they're seeing the onset of AI. I think the challenge is different. The challenge is really around where do I get started? How do I get started? And what is really a good program?
Sure.
Right.
Sure.
I've had conversations and I've run panels where I usually tell clients, panelists, I said, look, no AI project is a bad project. And they
Right.
look and they say, well, why would you say that? I said, because if you're doing an AI project, you're actually teaching your people how to think differently. If you're doing an AI project,
I
you're
like
actually
that.
driving towards new technology and you're embracing
Yep.
it.
Yep.
Failure is not always a bad thing.
Right.
Right.
True.
A lot of
True.
people think failure is a bad thing, and it's not. It's actually a learning opportunity.
Sure.
Failure becomes a bad thing is when you keep making the same
Yeah,
mistakes.
that's right. Yeah, you
Right?
keep failing.
So
Yep.
those are the kind of the conversations that I would have with clients.
So I want to wrap up with two questions.
Sure.
Put your engineer hat on, and because you're an engineer, what guardrails do you think that are most important for AI? And I'm talking about healthcare in general. What guardrails do you think need to be in place to make it effective but yet compliant?
First of all, understand the workflow.
Sure.
Never go
Yep.
develop a solution without understanding what the workflow is and what are the guardrails within the workflow, the compliance access, right? The technology limitations. So understand those guardrails first.
Sure.
Second thing I would say is understand the impact to the people that you're going to be impacting. What does it mean?
Yep.
Right? Because you could develop the best solution in the whole world, but if people aren't going to use it or don't feel comfortable using it,
True.
right? Or they are hesitant to adopt it, like
Yep.
using AI to when you do research, things
Yeah.
like that.
Right.
You really need to have those two guardrails in place, right? So understand the compliance aspect, then understand the people side of it. Because the technology's there.
Yeah,
It's not
that's a good point.
1970.
That's a good point.
It's not
Yeah.
1969.
Yeah.
It's
Yeah.
not, the Enigma machine.
Right. Right.
We're talking quantum. We're talking chips
Right,
manufacturing
right.
that's out there that's faster, processing speed, intelligent, right?
Yep.
So it's more around those two things. I'd
Yeah.
say that I consider them guardrails.
Sure.
And I think sometimes we forget that.
Makes sense. The last one is, once again, with your engineering hat on, what do you see is the most, I guess, where AI is the most efficient and effective right now in healthcare? Today, And then where do you see it going in the future?
Wow, efficient and effective.
Yeah.
That's kind of an interesting one, right?
That is, yeah.
And if we talk about healthcare, right, it's very efficient and effective in imaging.
Sure.
And it was funny because I was being interviewed about a specific product, and one of the questions was this product was not being embraced after a year, and they were asking the question, well, why is imaging so now predominant in hospital systems with doctors right? And I said, well, let's be very clear that AI is one component, but the technology of imaging has advanced substantially. That I go back and I use the example of, well, when I was playing Wolfenstein in college and I was playing a video game and it was all choppy, right?
Yep.
And now you play a video game today and it's all augmented reality.
Yeah, it is.
The imaging technology has advanced so much because if you applied AI to Wolfenstein, your output would be completely different than what you have today.
True story.
Right. So, I think that's where it's the most effective and efficient. And obviously in back office documentation areas where there's low risk. Right. I think where it's heading and where eventually it will be, and it's going to be a generational thing, is truly helping treat recommended treatments. I was attending a session here where one of the doctors was talking about actually telling, if you talk to your doctors of how you use AI to do research around your own illnesses and things like that. Have those conversations because they're seeing that the advancement's coming. Now, consent's a different thing. Recommended, therapies is a different thing. But, I do see it being more and more of the patient's perspective of doing their research, understanding what's going on. And generationally, you're going to see it's going to become more and more predominant. Like, it's going to be part of the conversation all the time.
No. And you bring a great point out because so we were talking with a very large group about 4 months ago, and what we were explaining to the physicians, the providers there was, look, your patients are in fact doing their own research, right? And with the tools today, they're getting some great information back. So wouldn't you want to, as a provider, to at least know what they're seeing in a very compact, shorthand kind of way given to you where you can see kind of what they're seeing so you can have that dialogue with them instead of just saying, hey, that's on, because used to we'd say the worst thing you can do is go Google what you think you've got. And
I would take it to the next level. I would say it's not just about seeing, but it's providing visibility through EMRs and EHRs of their actual medical records. And I'm going to give you a very personal story. My mom, who's 83 years old, 25 polypharmaceutical person, has 25 different drugs.
Wow.
About 4 weeks ago, went into the hospital for an emergency. They ended up finding that she had appendicitis. So me being in technology, me being in the healthcare space, I decided to go ChatGPT, Claude, do research. And I had a conversation with a clinician, and he was telling me, well, the studies in the last 5 years during COVID demonstrated that 30% of the patients came back. 30% were treated with antibiotics. And I said, all right, can I get to some of the references? Well, go to CDC, go here. So I pulled that into my studies. And then I went back and I said to him, okay, I get where you're coming. I said, but most of the studies at ages is 18 to 65. I said, we have an 83-year-old woman who's 25 polypharmaceutical, who is now off her beta blockers, off her Ozempic. She's in a hospital in a controlled environment. Forget about her risk at 83. Because that risk does not matter. That risk, whether you operate today or you operate tomorrow, does not matter. Right? It is truly a risk that's associated because of age. I said, but it's a controlled risk. I said, using technology, I'm looking at it and saying, statistically speaking, these are the numbers for a person of 65. She's 83 with 25 different drugs. Okay. So we ended up having the discussion and we ended up operating. They didn't want to operate because of the fact that she's 83, 25. And they said, well, the antibiotics are starting to work. And I turned around and I said, but you do realize if my mother comes back a year from now, she's got a 20% chance of survival, which I am not risking 20%.
Those aren't the odds
those aren't odds that I'm willing to risk.
And
that's my engineering hat going back into, right?
I like that.
So I think if you really see it, I think that's the conversation you need to have with some of your clients and say, hey, look, it's about not only the patient, but now it's the family.
Yeah.
Family around them that are doing the research, family that now are being advocates for themselves.
Yep.
Now, mind you, my mom's not an advocate for herself, so I was the advocate.
Right.
But she's also 83 years old who doesn't understand the technology the way I do. So that would be maybe a conversation that you should have with people and say, hey, look, I knew a guy that told me a little bit of a story, and you're going to have a lot of those guys and women and men that are going to be coming in that story later on. So
I like it. I like it. Well, I'll end with a note where my mom is 89. She got COVID. I was her advocate too. And I can tell you, I get what you're saying, and I'm going to use that because I never thought about pulling that piece into the conversation.
Listen to me. I will tell you this. We're in an industry that's a people industry.
Yeah.
That's truly about doing the right thing for people.
Yep.
So a personal story like that resonates because it's human.
Sure it does.
So we're human.
We're human.
AI still hasn't overtaken.
That's right. Right. But we are human.
Yeah, we are human.
Yep.
So at the end of the day, I would always, it's something that people can relate to.
Sure. Love it.
All right.
Thanks, man.
Chris, I appreciate
Enjoyed it. Yeah. Thank you.
Cool.
Thanks, Scott.